you and I, as they say, can actually stop HIV. So let's start off by welcoming, of course, my able panel this morning. I will start at the very end. We do have Dr. Lilian Otiso, who is the Executive Director, LVCT. Smack at the center, we do have Charles Karuga, who is a person living positively with HIV and here to share his story with us. Karibu sana. And then last but not least, right next to me is Maina, who is a counseling psychologist and, of course, HT. She will be telling us what that title actually means, but karibuni sana. Okay, Dr. Lilian, let me start off with you because we want to get back to the basics. Lots of still inquiries on people trying to understand which terminologies to use as far as HIV and AIDS is concerned. Many still say it's the same thing, but let's start off with you giving us, the basics.
Okay, so thank you. Thanks for having me on the show.
Yeah.
So just to start off, HIV is the virus that causes AIDS.
Yes.
AIDS being acquired immune deficiency syndrome, which is it happens after you've been infected by the HIV virus, the destructive element it has is it destroys the body's immune system and the immune cells. So it exposes you to get other opportunistic infections. So when you get a collection of them, that's what we call AIDS, because it's a syndrome. It's many diseases or many infections in the body at the same time. So that's what AIDS is. So we say that HIV is the virus that causes AIDS. But with the progress we've made these days, we're finding more people much earlier so they don't progress to AIDS, which is usually around what we call stage 4. Now the point is find people very early, put them on treatment, which helps to suppress the spread of the virus or how fast it multiplies in the body, so it does not destroy the immune system. And that way people are able to live healthy.
Okay, and even in terms of diagnosing the disease, can you tell us how it's done?
Okay, so we currently use rapid tests, and that's what we've used for a long time. So we moved from those days when tests would take 2 days to get results. Right now, within 15 minutes, you have your results. So how we do it is through a counselor, we'll provide some brief pre-test counseling, offer the test, and give you the results. We've also advanced technologically in terms of tests. So most people know about VCT or the voluntary counseling and testing, which is now evolving to basically HIV testing services encompassing a lot more, including the counseling, consent, confidentiality issues. But we also now have new technology around HIV self-testing. So someone can actually do a test on their own at home or within the facility if you wish.
Okay. Karuga, karibu sana yet again. You know what? You are the star of today's show because really, it is understanding, what your experiences are like. So why don't you take us back as to how you discovered that you actually are HIV positive?
Shiko, again, thank you so much.
Yeah.
Again, in the previous, I said I was born positive, and it took me a while before me knowing my status. Because again, in the past, you wouldn't imagine a kid being positive.
Right.
In the days, HIV was meant for the immoral society.
Yes, in quotes, right?
Yeah,
that's what we knew.
So suspecting a kid might be positive was way outside the thoughts. So until one of the neighbors suggested to my siblings, why don't you take the kid and do some tests on HIV, since I was having so many diseases, like pneumonia, malaria. Yeah, the infections were so rapid, so the suggestion came, go and have the test, and it was positive. Although that didn't affect me since I was a kid, so the impact
and
wasn't much.
You didn't really understand what it was.
Yeah, so my big sister was the one who was having the hard time, because having a positive kid in a society where stigma was so rapid, it was quite a challenge.
Wow.
Yep.
Now, this brings you in, Jane, because she's just mentioned something, Dr. Lilian mentioned something, and she used the word counseling. I want to understand how vital is your role as a counselor when it actually comes to dealing with testing and dealing with HIV. Can I say patients, for lack of a better word? Yeah.
Okay. Thank you. I think first and foremost, I'm glad that I'm here to shed some light on the same. And probably that will take us to probably a discussion that we will want to have, what words to use and what phrases to use.
Right.
So patients, no, if they're people living with HIV.
Right.
That's a correction. So talking about probably the stigma around, stigma are attitudes and beliefs that people have formed around the issue of HIV. While discrimination is actually the behavior that is portrayed to people having HIV and AIDS. So counseling then for a person living with HIV and AIDS is very vital in terms of allowing them to be able to cope with the disease or with the virus as they continue living. So I believe that if a person is taken through this counseling or is supported to cope with the situation, then he can live a life that is better.
Okay.
Yes.
So do you normally engage with the individual before they actually go in for their testing, or it is purely after?
Well, it is actually, Dr. has mentioned about counseling, voluntary counseling before. But nowadays is the testing that is done diagnostically. Like if you go into a hospital, then this has to be done. In our services, in our counseling organization, we do have people coming in for counseling services. And if someone would probably during our assessment, because we have something that we call assessment, if you would identify that this person is coming in for HIV testing or no counseling, then you would need to take this person through. Before the test, then you would have to take this person through pre-counseling, so that then you're able to know how are they going to handle, what are the expectations about the test, what makes them come for counseling, just what made them think about coming for the counseling of HIV and AIDS and not any other. You get to understand first, why do they want to come and seek counseling? Then that way you're able to know how to support them.
Let me let our audience know that they can actually call in at this particular time, and please do. We do have our numbers at the bottom of the screen in case you do have a question that you actually want to throw to our panel this morning. But speaking about the question of the day, we want to put that up on the screen very quickly for you. And it's a simple one. Do you know your HIV status? Wow, very timely if you ask me. Do you know your HIV status? It's actually a good time to start highly considering knowing your status. And of course, if you want to get in touch with us through our social media platforms at K24TV on Instagram, Facebook and Twitter. Dr. Lilian, what are some of the neglected issues that you see on the ground as far as the HIV response is today?
Okay, that's a loaded question. There's a lot of issues going on. One of the things we've seen is people don't think that HIV is such a serious issue anymore. Yes, because it's not talked about as much. You don't see a lot of maybe adverts and promotion. But it's still a big deal. We still have a lot of people living with HIV. About 400,000 are not yet diagnosed. 1.1 million are on treatment, and that's working very well. So what we know is that if you're HIV positive and you're put on treatment, the antiretroviral therapy, then the outcomes are very good. If you attain viral suppression, then you're good and you live a normal, healthy life. The challenge we have is finding those people who don't know their status. So going out, testing them and being and identifying those the individual. And as I mentioned, early in the disease, before it progresses to get to stage 3 or 4, before people start getting sick and getting to hospital. So that's the main focus. And we're really trying to find who are those who are most vulnerable. Right now, from the data, it shows that it's a lot of adolescents and young people who have the highest rate of new infections and are still exposed. We also have the key populations. In Kenya, we're talking about men who have sex with men, sex workers, and people who inject drugs as some of the groups that are at high risk of HIV infection at the moment. All
right. 1 second, because I understand we've got a caller on the line. I believe it's Dorcas. Boniface. No, sorry, Boniface.
Yes.
Good morning. How are you?
Very good. I'm glad to be part of the show this morning.
Thank you for calling.
Yes. I just have a question.
Yeah.
If right now we can buy the test kits from the shops and test for ourselves at home, then where does counseling come from? Because now if I have the test at my home and I test and probably I find myself positive, and then who counsels me then?
Okay. Thank you so much for that, Boniface. I think you can take that, Jane.
Yes. First and foremost, the decision to take a test at home falls with the client.
Okay.
So if a client would come for counseling and would want that this testing is done at the comfort of their home, then I would allow.
Okay.
But the only thing is that we would really talk about it, have the person be at peace and at ease with whatever results, because pre and post probably will be done during the counseling session, then we can be able to handle that. When I am comfortable that the client can be able to handle the situation, then I can allow them to do that. And also, I believe also daktari, at their level, at the hospital, they're able to also handle that.
Okay.
Yes, so I don't know what you would say about that also.
Okay. For you, Karuga, let's get into how, when you fully came to understand your condition, what that meant to you. How did you even view it? What was your perception once you came of age and you understood, oh, so this is what it means?
Well, Shiko, at the age of 15, it's when I got to fully understand what HIV was, and learning of it that it's inside me was quite a challenge, because the maids that were revolving within the society are so cruel. So imagining me, all that shit will happen to me was quite fearing. But with the time, it was amazing seeing that every day they say it was not happening to me. So I'm like, what is not happening? Until now, I found my counselor and told me that it's HIV virus, and it has no harmful until you default from the medications, the ARVs.
Just hold that thought right there. I understand we've got another caller. Don't forget that thought. Yes, good morning.
Yes, good morning.
Yes, we have John, actually, from Kitale.
Yes.
Okay, yes, John. Karibu sana.
Yes, I would like to ask. Yes, how can a couple have children if, for example, one of the partner is infected with the HIV virus?
Okay, thank you so much for that. Good question. Okay, Joshua from Kirinyaga is on the line. Good morning, Joshua.
Morning, Shiko.
Sasa.
I'm very well. How about you?
Good. Thank you, Joshua.
Yeah, I feel that as we discuss this topic on HIV and AIDS,
right,
and as we try to combat the scourge, I think it should not be lost on us to address the key factors that lead to the high prevalence of HIV in our country, and especially Africa, which is largely poverty. You realize HIV prevalence is higher in poor households, especially among the females.
Right.
And it's also exacerbated by our cultural practices. So if we are unable to address poverty amongst our populace, then it's going to be very difficult to address and really to combat this war against HIV. Right. That's my take for today.
Okay, thank you. Good point there. Santi Sana, we'll talk about that in just a second. Karuga, please feel free to finish your point. Yeah.
Okay, as I was saying earlier, so when I met the counselor, she explained to me that what is new, it's a virus that is not harmful if you are on drugs, but if you default, it will start to attack your immunity. Yeah. And then she changed my perspective from the harsh reality that was being said in the society.
That it's a doomsday situation,
other stuff, to a comforting mindset that it's only a virus, and if I stick on my medication, it's no longer harmful. It's something I can host and live a positive life. And
did you feel like you blamed your mom or your parents at some point?
Apparently, that thought never came along, because my parents left. Okay, they died at an early age, because my dad passed in 1997 and I was born in 96. So I never even got to have the images of him. And the mom passed in 2000. So there's no one to ask.
Right.
And again, there's something that I said that played a big role in me, the support system from my siblings. So they used to tell me, whatever happens, there's a reason behind it. So God knows your way.
Yeah.
So the blame factor was never in my thing, because I believed God is there and has a purpose for this.
Wow, that's really living positively, yeah? Okay, so discordant couples are actually defined as those where one partner is HIV infected and the other is not. Let's jump a little bit into that, because this was perhaps one of the top 5 questions that popped up when we said we're going to have this talk. Let me start off with you, Dr. Lilian. Health-wise, what are people looking at in terms of their options here? You've got one person who's HIV positive, the other one is negative. If someone has this interest to date, to marry, to find love, but their partner is HIV positive, what next? And I think you can even tie that in to the question that came in from John and Kitale. How do couples go about having children and making sure they're HIV free?
Okay, thanks for that. And just before I dive into that, I wanted to add to something on the HIV self-testing question.
Yeah.
So how we are offering it now is you can buy it in the chemist, or you can find it in like a facility like ours.
Right.
But we provide like telecounseling, like LVCT provides a toll-free hotline. The number is 1190.
Yeah.
If you test with it and you want to know how do I carry out the test,
yeah,
or what does this result mean, then you can call and find out. But also, we use the self-test kit as a screening test.
Yeah.
So you should go, in case it screens positive, you must go to a facility to now do a confirmatory test.
Okay.
So that then it mitigates those issues of the counseling and the fears that people have.
Right.
And now to the issue of the couples and the discordant couples. Yes, we have a large number of discordant couples, actually over 300,000, we say, from the last statistics we had. So, and this is a case where one is positive and the other partner is negative. We don't know the reasons and we don't try to speculate around it.
Right.
And some people even get into discordant couples knowing, into discordant relationships knowing that.
Oh, okay.
But what is available right now are different prevention options. One of them is, and actually the first thing is, if the HIV positive partner is on treatment, is on ARVs, and attains what we call viral suppression, where when we do a lab test, we say it's undetectable. We can't detect the virus.
Right.
It doesn't mean that you don't have the virus. It means that we've controlled it to a level which it's not really freely circulating so that it causes infection or makes you sick.
Yeah.
So that's one of the ways that we protect the negative partner, just by making sure the positive partner is virally suppressed. The second one, for the negative partner, we now have what we call pre-exposure prophylaxis, or PrEP in short.
Right.
It's also ARVs given to the negative partner, because evidence has shown that if that negative partner takes this medication, they prevent themselves from acquiring HIV, which is what we've actually done with the PMTCT, the one for babies, preventing babies from getting infected. We give them the antiretrovirals before they get infected, so that it stops the virus from, should I say, implanting in the body. Okay. So that's we provide that option. Of course, we continue providing counseling and ongoing support. The issue of using condoms and safe sex, the same preventive messages we talk about with everybody else.
So I'm trying to imagine the couple who are probably married. What is their lifestyle now? Is it that, yes, it will have to be PrEP for the rest of my life, or what happens?
We don't say the PrEP is until the positive partner is virally suppressed.
Okay.
But we also advise use condoms continuously. That's the advice we give.
Okay.
Well, we don't know what people actually do.
Right.
So that's one of the things. In terms of getting babies, there again, if the positive partner has attained viral suppression, the chances of infecting the negative partner or the baby are also reduced. So that's one of the key things we look for that viral suppression. And when the baby is born, if the mother is the one who's positive, then they're taken through the whole PMTCT package, the testing, and the baby being given antiretrovirals until they stop breastfeeding to make sure we reduce that risk. So basically, to say it's normal, they can live a normal life, a normal
so this should not,
yes.
if they're proactive with it. And I'd want you to expand a little bit in terms of, when we get to babies in just a bit. But let me rope you in, Jane. Even when you talk about couples and even getting into the dating scene like this, this is a deal breaker for a lot of people. I mean, even one of the questions that we probably even should throw out there is, would you even go ahead and date someone who is HIV positive and you know this? Deal breaker, yes or no? So we'll get to that in terms of understanding the emotional part of it. Yes. But let's talk to Kagama very quickly. He's on the line as we get to you, Jane, in a bit. Yes, good morning, Kagama.
Good morning.
Yes, hi.
I'm fine.
Yes, karibu.
Asante nashukuru. Nataka kuchangia ile mjadala inaendelea pale.
Karibu.
Ya kuhusu HIV, importance of knowing your HIV status,
Right.
Shiko Kaitani, how are you?
I'm fine. Thank you, Kagama. Go ahead.
I am from Imuru and I'm a counselor on that field. And I want to congratulate the panelists who are doing that good job. But I want to start by saying that there is a lot of importance in knowing your HIV status,
Right.
Because you'll be able to plan your life and take care of yourself, However, I feel that HIV is spreading not because of, I slightly differ with my friend who talked about poverty, that poverty is contributing to HIV.
Right.
Because we have got a lot of rich population who are getting infected. But I think we are failing to address sex as a need. Sex is a need, it's a basic need.
Yeah.
And when we do not address it, especially in marriage and in other relationships,
right.
actually that's where we are going wrong. It's high time we stop spiritualizing issues and we talk the things the way they are. Because sex, I believe, is a need, and the need has to be met, you know?
Yeah.
It has to be met in the right place. So people have to be taught the truth. We should remove the taboos, the myths, the innuendos,
and
all
the
that
labels
surrounding the HIV pandemic, so that people can really own it. When people are married, let them be serious in their relationship. Let them not look at sex as it is a sin or anything like that. I'm saying that because I'm in the field and I'm getting all those things. I'm getting all these challenges from different couples.
Oh, okay. All right. Well, thank you so much for sharing. That's how things are on the ground. And I guess you can add on to that. Yes, you were saying, Jane.
Yeah, you mentioned that if people are to get ready into this kind of a relationship when they know that their partners are already infected, it is okay if they choose to.
Yeah.
Because there are people who will want people. I see people even on social media asking for people who are already positive. Either themselves are positive or they still want just someone who is positive.
Okay.
For whatever reasons.
Yeah.
And for me then as a counselor is to come and back their emotional stability and well-being. So if this is what they really want, because I want to work with this client and understand, is this really what you want? And mine is to be able to support them, probably offer their insights, just be able to shed some light. Probably if it's not anything that they understand about, then we want to discuss this together. Do you know the pros? Do you know the cons? And if with all this information, they still choose to continue and date a person who is HIV positive, then it becomes actually their responsibility.
For those who are broken, because for them it just signals infidelity.
Yes.
That umeniletea ugonjwa kwa nyumba.
Yes.
How can you do this to me? How do you deal with such cases?
Now, it's a tricky situation.
Yeah.
Because when they come with a mindset.
Okay.
But we want to walk this journey, like I mentioned them. Because for them, if the HIV is already in their family, it's already here, then we want to discuss, so how do we move on from this point? Because then this is where we are, and how do we move on? Then we'll look at the probabilities and whatever choices then they would want to make. And then this is what we are going to support. And at the bottom of it all, the emotional well-being of the client is at hand.
Okay.
Yes.
I'd love to hear your point of view on that in just a moment, Karuga, but let's take a short commercial break. We'll be back with more as we continue this conversation around HIV and AIDS. Of course, we continue to commemorate World AIDS Day. It was marked just yesterday. And so we're trying to find out how far are we in terms of the HIV and AIDS response, and how can we as a community stop, of course, HIV. We'll talk a little bit more about that when we get back, but keep those texts coming, keep those phone calls coming. We'd love to hear from you this morning. Asante sana.